One day you're energetic and sexually active, the next you're feeling tired and disinterested? The cause might not be your age, but potentially certain medications. Research suggests some commonly prescribed medications may influence testosterone levels and sexual function. And this information isn't always discussed during medical consultations. Every day, millions of men take medications prescribed to address important health concerns. Blood pressure medications, cholesterol-lowering drugs, certain mood stabilizers. These are often prescribed with the best intentions to address serious health conditions. However, some research indicates that certain classes of medications might potentially influence aspects of men's health in ways that aren't always thoroughly discussed during medical appointments. The changes can sometimes be gradual, making it difficult to recognize patterns. Many men attribute decreasing energy, changes in muscle mass, or shifts in intimate wellness to the natural aging process. But some scientific literature suggests medication effects could potentially be contributing factors worth discussing with healthcare providers. This conversation isn't about questioning the importance of prescribed medications. Many pharmaceutical treatments are essential and potentially life-saving for serious medical conditions. Rather, it's about promoting informed discussions between patients and their healthcare providers about all aspects of health, including quality of life considerations. I'm Dr. Rachel Thompson, and for over 25 years, I've specialized in men's health and hormonal balance. I've worked with thousands of men experiencing various wellness concerns, and sometimes we've discovered that certain prescription medications might be influencing their overall well-being. Today, I'm going to discuss 5 categories of commonly prescribed medications that some research suggests might affect male wellness, explain what current medical literature indicates, and share evidence-based complementary approaches that might be discussed with healthcare providers. Before we continue, I'd like to invite you to subscribe to our channel and hit the notification bell. Each week we share evidence-based health information for aging men. And if you're currently taking prescription medications and interested in optimizing all aspects of your health, type health in the comments below. I read every comment and value understanding your specific situation. Now let's discuss the first category of medications that some research suggests might influence male wellness. Cholesterol-managing medications. Certain cholesterol medications are among the most commonly prescribed treatments in America, with millions of men taking them daily to support cardiovascular health. What some medical literature suggests is that there might be a relationship between these medications and hormone production. Some studies have observed that cholesterol is one of the raw materials from which the body manufactures several hormones. Some researchers theorize that significantly reducing cholesterol availability could potentially influence the biochemical pathways involved in hormone synthesis. A study published in the Journal of Sexual Medicine observed an association between certain cholesterol medications and modest changes in hormone measurements in some men. Another study in the Journal of Clinical Endocrinology and Metabolism noted potential correlations that might warrant further investigation. These observations align with our understanding of biochemistry. The body converts cholesterol to pregnenolone, which then undergoes a series of enzymatic reactions that can lead to various hormones. Some researchers suggest that altering the availability of the initial substrate might potentially influence downstream processes in some individuals. Robert, a 64-year-old patient who had been managing his cholesterol for 8 years, consulted me about persistent fatigue and decreased vitality. His previous healthcare provider had suggested these changes might be age-related, but laboratory testing revealed hormone measurements that warranted further discussion with his specialist. After consulting with his cardiologist, Robert implemented a comprehensive approach that included certain dietary modifications, specific supplements, and a treatment plan adjustment under medical supervision. Within several months, his follow-up testing showed improvements, and he reported feeling more energetic. I had assumed these changes were simply part of growing older, Robert mentioned during his follow-up visit. Discussing all aspects of my health with my healthcare team has made a noticeable difference in how I feel overall. I want to emphasize an absolutely critical point. If you're currently taking any prescribed medication, never discontinue or adjust your dosage without consulting your healthcare provider. These medications are prescribed for important medical reasons, and any changes should be made only under appropriate medical supervision. The goal isn't to question necessary treatments, but rather to have comprehensive discussions about optimizing all aspects of health while effectively managing medical conditions. For individuals interested in complementary approaches to cholesterol management, some research suggests certain natural compounds might offer supportive benefits when used under medical guidance. Some plant-derived compounds have been studied for their effects on lipid profiles. Plant sterols and stanols have been researched for their potential effects on cholesterol absorption. Certain citrus extracts have shown interesting results in preliminary studies examining lipid metabolism. And dietary approaches like the Mediterranean eating pattern have demonstrated beneficial effects on cardiovascular parameters in some research. Thomas, a 58-year-old with mild cholesterol elevations, worked closely with his healthcare provider to implement certain nutritional approaches as part of his health management strategy. Over several months, his follow-up testing showed improvements in various health markers. His doctor was pleased with his overall health status, and Thomas reported feeling well in all aspects of life. The second category of medications that some research suggests might influence certain aspects of male wellness is a class of blood pressure treatments that work by affecting certain receptors in the cardiovascular system. Some of these medications are prescribed to millions of men to help manage hypertension and certain cardiac conditions. While these medications can be very effective for their intended cardiovascular purposes, some studies suggest they might potentially influence other bodily systems in ways that merit discussion. Some of these blood pressure medications work by modifying the effects of certain neurotransmitters, which helps regulate heart rate and blood pressure. Some researchers have observed that this same mechanism might potentially influence other bodily systems that utilize similar neurotransmitter pathways. Beyond the documented association with certain changes in vascular function, some studies suggest potential effects on energy levels and other aspects of well-being in some individuals. A review published in the Journal of Hypertension noted varying frequencies of certain quality of life changes among people taking different classes of blood pressure medications. What's particularly relevant is that these changes can sometimes develop gradually, making it less likely that patients will connect these changes to their medication regimen without specific discussion. James, a 62-year-old who had been managing his mild hypertension for 5 years, consulted me about certain wellness concerns despite maintaining an active lifestyle. His hormone measurements were actually within reference ranges, suggesting other factors might be contributing to his symptoms. After discussing his situation with his cardiologist, James's treatment plan was adjusted to include a different class of blood pressure medication that research suggests might have a different side effect profile. Within several weeks, he reported noticeable improvements in overall well-being. I hadn't considered that my treatment might be influencing these aspects of my health, he shared. I'm grateful my healthcare team was willing to explore alternatives that worked equally well for my blood pressure. For individuals who require certain blood pressure medications for cardiac reasons and cannot safely transition to alternatives, several complementary approaches might be discussed with healthcare providers. Certain amino acids have been studied for their effects on vascular health. Some plant extracts have shown interesting results in studies examining endothelial function, and specific physical therapy approaches might offer complementary benefits for some individuals. The third category of medications that some research suggests might influence aspects of male wellness includes certain treatments for mood regulation, particularly those that work by affecting serotonin pathways. These important medications have helped millions of people manage significant psychological health concerns, but some studies indicate they might also influence other aspects of well-being that patients may wish to discuss with their healthcare providers. These medications typically work by modulating neurotransmitter levels in the brain, which can effectively support mood regulation. However, some research suggests these same neurotransmitter systems may play roles in other bodily functions as well. Additionally, some studies indicate that certain mood medications might influence hormonal regulation in some individuals. A study published in the Journal of Clinical Psychiatry observed that a notable percentage of individuals taking certain mood medications reported changes in aspects of intimate wellness. What makes this observation particularly relevant is that these very changes can sometimes contribute to mood challenges, potentially creating a complex situation for individuals trying to optimize their psychological health. Michael, a 54-year-old who had been effectively managing his anxiety for 3 years, described his experience this way. While my medication was definitely helping with anxiety, I noticed other aspects of my life seemed to have less vibrancy over time. I felt somewhat muted in my responses to things I previously enjoyed. Working collaboratively with his psychiatrist, Michael explored a multifaceted approach. His treatment plan was adjusted to include a different class of mood medication that some research suggests might have a different side effect profile. His healthcare team also suggested certain nutritional compounds that support general mood and well-being, and recommended specific lifestyle modifications to complement his treatment. Within several weeks, Michael reported improvements in both mood and overall vitality. I didn't realize we could potentially address both aspects of my health simultaneously, he shared. Having these comprehensive discussions with my healthcare team has been extremely valuable. For individuals who benefit significantly from certain mood medications, and for whom treatment changes might not be appropriate, several complementary approaches might be worth discussing with healthcare providers. Certain plant extracts have shown interesting results in studies examining both mood and vitality. Specific adaptogenic herbs might offer complementary support for overall well-being. And mindfulness practices have demonstrated benefits for multiple aspects of health without interfering with the therapeutic effects of prescribed treatments. The fourth category of medications that some research suggests might influence aspects of male wellness includes certain acid-reducing treatments, particularly those that significantly reduce stomach acid production. These medications are widely prescribed, with millions of men taking them regularly for acid reflux, heartburn, and related conditions. Some medical literature indicates that extended use of certain acid-reducing medications might potentially influence nutrient absorption in some individuals. These medications can be very effective at reducing stomach acid, which is their intended purpose. However, some research suggests that stomach acid also plays important roles in the absorption of certain minerals and nutrients that may contribute to overall well-being. A study published in the journal Andrology observed potential associations between long-term use of certain acid-reducing medications and various health parameters in some men. Another study in the International Journal of Impotence Research noted correlations that might warrant further investigation. William, a 68-year-old who had been managing his reflux for almost a decade, consulted me about fatigue and other changes in well-being. Laboratory testing revealed certain nutritional parameters that merited attention, including levels of specific minerals and vitamins that some research suggests might be influenced by reduced stomach acid. We implemented a comprehensive approach to address his reflux through dietary modifications, stress management techniques, and certain botanical supplements with coating properties. Working with his gastroenterologist, William gradually adjusted his treatment approach over time. Several months later, William's reflux remained well managed with his new approach, and follow-up testing showed improvements in his nutritional parameters. I had been taking that medication for so long that I hadn't considered exploring other approaches, he told me. I'm pleased we found a strategy that addresses my reflux while supporting my overall well-being. For individuals who experience acid reflux, several complementary approaches might be worth discussing with healthcare providers. Certain botanical extracts have been studied for their coating effects on the digestive tract. Aloe preparations have been examined for their potential soothing properties. And interestingly, a sleep-supporting hormone has demonstrated unexpected benefits for digestive comfort in some research, possibly by influencing the lower esophageal sphincter. The fifth category of medications that some studies suggest might influence aspects of male wellness includes certain pain management treatments, particularly those that work through specific receptor systems. While the potential for dependence with these medications has been widely discussed, some research also indicates they might influence hormonal regulation in ways that merit conversation with healthcare providers. Some pain medications interact with specific receptor systems that help manage pain perception. However, research suggests these same receptor systems may communicate with the hypothalamic pituitary axis, the control system that helps regulate various hormonal processes. Some studies indicate this interaction might potentially influence hormonal balance in some individuals, particularly with extended use. A study published in the Clinical Journal of Pain observed associations between long-term pain management treatments and certain hormonal parameters in a significant percentage of study participants. Another study in the Journal of Pain noted potential hormonal changes within relatively short timeframes in some individuals. David, a 59-year-old construction worker who had been managing chronic pain for 3 years following a significant back injury, consulted me about what he described as profound fatigue and diminished vitality. Laboratory assessment revealed hormonal parameters that warranted further discussion with his healthcare team. Working collaboratively with his pain management specialist, David implemented a comprehensive approach to pain management that included certain cannabinoid preparations, specialized medication approaches, traditional Eastern medicine techniques, and specific physical therapy protocols. This multimodal approach allowed David to gradually modify his pain management strategy over time with medical supervision. As his treatment plan evolved, David's hormonal parameters began to normalize. Several months later, he reported improvements in energy, mood, and overall vitality while maintaining adequate pain control. Living with chronic pain presents many challenges, David acknowledged, but working with my healthcare team to address all aspects of my health has substantially improved my quality of life. For individuals requiring ongoing pain management, several complementary approaches might be worth discussing with healthcare providers. Certain specialized medication protocols might provide pain relief with different side effect profiles. Cannabinoid preparations have shown promise for certain types of pain in clinical research, and targeted nutritional compounds have demonstrated interesting pain-modulating effects in some studies without the same receptor activity as traditional pain medications. What's particularly important about potential medication effects on aspects of male wellness is how often they might go unrecognized and undiscussed. In my practice, I regularly meet men who have experienced changes in energy, mood, or vitality for extended periods without ever considering potential relationships to their medications. Healthcare providers focused on managing primary medical conditions might not routinely inquire about these quality of life aspects. And many patients, assuming these changes are simply inevitable aspects of aging, might not initiate these discussions. This creates a situation where important quality of life factors might not be optimally addressed within the healthcare relationship. The solution isn't to question necessary medical treatments, but rather to foster more comprehensive discussions that consider all aspects of health, including vitality and overall well-being. If you're currently taking any medications and experiencing changes in energy, mood, or vitality, consider including these topics in discussions with your healthcare providers. Ask about the full spectrum of potential medication effects, and inquire whether treatment adjustments or complementary approaches might be appropriate for your specific situation. Remember that all medication discussions should occur under appropriate medical supervision. Never discontinue or adjust prescribed medications without consulting your healthcare provider, as doing so could potentially create serious health risks. The goal is collaborative decision-making that optimizes all aspects of health while effectively managing medical conditions. Beyond medication-specific considerations, several approaches might support male vitality, regardless of medication status. Regular resistance exercise has demonstrated benefits for multiple aspects of well-being in clinical studies. Adequate sleep quality is fundamentally important for hormonal regulation. Stress management techniques like meditation can help optimize cortisol patterns, which research suggests may influence other hormonal systems. And proper nutrition, particularly adequate protein, specific minerals, and certain vitamins, provides foundational support for overall health. Dr. Abraham Morgan-Taylor, a respected urologist and researcher, expresses it well. Men deserve comprehensive health care that addresses both their medical conditions and their quality of life. When treatments influence vitality, exploring alternatives that preserve both health and well-being becomes important. Fortunately, medical science continues to develop options that allow for individualized approaches. So let's summarize what we've discussed. Research suggests that certain categories of prescription medications might potentially influence aspects of male hormonal health and vitality through various mechanisms. Cholesterol-managing medications might affect hormone production pathways in some individuals. Certain blood pressure treatments might influence neurotransmitter systems related to energy and mood. Some medications for psychological health might affect multiple bodily systems. Acid-reducing treatments might influence nutrient absorption. And certain pain management approaches might interact with hormonal regulation. For each medication category, potential complementary approaches or alternative treatment strategies might be available that could help optimize quality of life while effectively managing medical conditions. These alternatives should always be explored through informed discussions with qualified healthcare providers, with careful attention to addressing primary health concerns while supporting overall well-being. If this information has been valuable to you, please consider sharing this video with others who might benefit. Many individuals experience changes in vitality without realizing that collaborative discussions with their healthcare providers might reveal opportunities for optimization. Subscribe to our channel for more evidence-based health information, and tap the notification bell to stay updated on future content. Each week, we explore different aspects of men's health, always focused on practical, scientifically informed approaches. And please, share your thoughts or questions in the comments below. I read every comment and value your input. Your feedback helps guide the topics we address in future videos. Thank you for joining me today. I'm Dr. Rachel Thompson, wishing you optimal health and well-being in all aspects of life. Until next time, take good care of yourself.